impatient person, whereas a patient is expected to be a patient person. So there is a conflict. Now, a person who is paying out of his own pocket or is well-heeled and has the resources would go for what he believes is the right quality. But a person working for a bank, a person working for a state government enterprise, or working for a company that follows the CGHS pricing would tend to believe that all labs have same price, which is incorrect, because it costs a lot more, as Dr. Suri and Dr. Manchanda just mentioned. It costs a lot to have a quality standard running. To give you an example, each equipment in a good laboratory is run through controls every morning, whether a test takes place or not. So there is a cost of controls, there is a cost of calibration which is being incurred irrespective of the business. Now, that doesn't happen in a small laboratory which does not need to observe this, and therefore the mistakes take place. I do want to share one very important number, sir. We get close to 35 to 40,000 tests a day, of which at least 5 to 10,000 are for second or third opinion, because they've been tested elsewhere, and the doctor says, I do not believe these results, they are not matching with my clinical judgment, so please go back to a better laboratory to get that done. So I think the challenge is real, and I'm really happy that government has taken cognizance and has accepted that those of the laboratories, those of the institutions who have volunteered to get this voluntary accreditation done should get high reimbursement. But I'm mindful of the fact that in daycare business, there is a huge challenge. A lot of insurance companies in India do not accept something that happens in a day. You're expected to stay a hospital in a night to claim insurance. So I don't know how you've overcome that problem. But
yeah, this is a very important issue actually, which you have touched, sir. Actually, on one side, the insurance says that the patient has to be admitted and then they will be reimbursed. Actually, where actually we can cut down the cost when the patients are being treated on the daycare basis. Actually, so I think maybe the government, maybe the insurance company has to change their policy. Actually, why unnecessarily they should pay extra? So I like to have your comment on this, because you may be facing this type of challenges day-to-day basis. Actually.
See, actually, I would say that it was tough 15 months back when the first center was opened in Bangalore. I think it took a lot of work at the part of the management team of Nova to go and meet each insurance provider and the TPAs, because they work together. As I speak to you today, we have now 3 running centers, and we are empaneled with all the insurance and TPA company in India. In fact, they are coming up, I must say that a lot of time hospitals are coming back to us now saying that they are being forced to follow the same rate in the hospital. So it took some time. It didn't take any regulation, but because we give 15%, 15% reduced cost of care per patient. And I think that's a big ticker for any insurance and TPA, which work on very thin margins. So currently, if you ask me, 70% of the surgeries what we do are through insurance or through corporates, and they all have been approved and paid in last 1 year.
Now another thing, actually, there is another challenge that on one side the patient wants the latest technology, latest facilities. We also want that our doctors should be well equipped with the latest technologies so that they are able to deliver. Then there is a demand from the industry that you have to go for it, but everything revolves around the dollar or the money, the rupee. Right? So then appropriately this guiding principle which has been said that we must balance the wish list of the healthcare industry, the need list of the professionals, because we want that they should be effective, and the want list of the patient, the community and the population. Because why patient or community or population will compromise on that actually? So I'll ask this question to Dr. Manchanda, how you react to this actually?
It's a very interesting question actually. I also struggle to find an answer, especially very close to pathology there's a radiology business, and when you go and talk to people they said I have got starting with single slice CT, and now it has become 126, 128, now 256. It just goes 500, just goes on and on. And that actually has become a differentiator for you to get the business. Now, look at it from a patient perspective. Now, whether single slice or a 500, whatever that number is really going to make a difference. And I think to best of my knowledge, yes, it may make a difference, but will it make difference to diagnosis? I'm not very sure. So I think the way one has to look at this technology and the investments and basically the money part of it, you really have to segment the market. And I think on one side, when you're talking about the 70% population which has no access to healthcare, mainly because of their purchasing power, affordability is not there. I don't think we can afford to have this high-tech solutions for that. And I think the ecosystem really has to address this, because otherwise many of these companies which are into selling their instruments, they are just pushing the market for all these equipments which are making the cost of healthcare so expensive and taking it out of reach from common man. And I think it's for leaders like us who have to really take cognizance of this and address this area. While it's good to have a high-tech instrument in one place, may not be very advisable in another place. And I think my view in this would be that you need to have a gradation of the market and see what best is required to address that segment, so that we have an eye on making healthcare accessible.
I like to differ a little bit here. I have seen in these 31 years, from manual to semi-auto to automation, improvement in IT technology, and I find that my costs have never gone up because of the automation. Rather, my costs have come down if I have a volumes. That is a prerequisite. If I have the volumes, by automation, my costs have not gone up, rather they have come down or stayed there. My quality has improved. My results are more reproducible. My reports are acceptable to my clinician, to my patients. So probably the automation which we took was needed. It was not needless. So I feel automation will not always add to our costs. Rather, it will probably reduce our costs. Our capacity to work in larger volumes is possible today. That's why probably the corporate labs have sprung up, because it is just possible to do a lot of work with the automation. Thank you.
Another important issue which is being debated actually almost day in and out in healthcare institutions and the public also, about the patient safety actually. So how to ensure or inculcate a culture of patient safety in the institutes, in the hospitals. And it is rightly said that the improving technology and innovations would not eliminate all the medical errors, but definitely they're going to decrease the errors. So I'd like to have a take on this from Dr. Chaudhary actually.
I think patient safety is paramount. Patient safety is the alphabet A of healthcare in many ways. If we cannot do to our patient whatever we are doing safely, then I think we are actually not solving the problem but compounding the problem. Now, patient safety has a cost. Therefore, to begin with, the moment you adopt safe practices, in the short term, the costs tend to go up. But I think Dr. Suri compliments to you for bringing this out, that good technology is not necessarily expensive technology. Good technology is, or good practices are those that are usable by the median of the population and left of median and right of median, both correctly and accurately. Now, we know that the more you use a thing, the cheaper it gets. Whether it is latex gloves, whether it is vacutainers to bleed a patient, whether it is the time required to perform a CT or an MRI procedure, or a surgical procedure. The essence is that patient safety must come first. Now, I think innovation has a way of being successful. Now, there are companies who go and buy an equipment because it's the latest. The latest doesn't mean that it will be successful. The latest doesn't mean that it will be sustainable. But if it is successful and it is sustainable, it will also bring down the cost eventually. I think Dr. Manchanda said a very correct thing in mentioning that as an economy which is fundamentally resource-starved or under-resourced, because we cannot go and get everything that we want in the world, we have to use our dollars and cents, our rupee and paisa very wisely, and not necessarily rush into bringing into our hospitals, into our daycare centers, into our laboratories, into our imaging centers, the latest. But we must bring what is proven and the latest, which stands the technology test. Market ultimately is a great dispenser. Only the fit will survive. There are innovations. Jokingly, it is said that the creation of human life also is the struggle of the fitness. Out of millions, only one succeeds in fertilizing the human life. So also, I think a lot of people bring a lot of things, but innovation has to be mindful. I would beg your permission to make one small point. We have a regulation in India called PNDT, which is a bit of a hawa. For good reasons, that we have to prevent female feticide in this country, correct the gender ratio. The reasons some of the companies got together and created a portable ultrasound that would work without live electricity was that it should be able to go everywhere. A gynecology examination without ultrasound is an incomplete examination. The moment you split the gynecology from the sonology, I think you are taking double the time to do something which is very simple. But the fact remains that we are sitting in a part of India which has probably 900 women for every 1,000 men, and we are close to a state of Haryana which is 850 or 860, whereas there are more women in the world than men. So I think the danger is real. But now here is a beautiful technology that can be used. Ultrasound is a very basic process, very simple thing to use, only if we choose not to abuse it. So I think medical conscience and the patient conscience both are equally important to make the innovation sustainable.
Thank you, sir. Actually, another issue that maybe we keep on talking that maybe the innovations or technology is expensive and we cannot afford on one side. But I feel it has to make the things more comfortable for the patients, actually. Like mobile technology you are talking about, actually. Like I have seen in USA there are mobile lithotripsy machines, actually, and other MRI units which visit one hospital on one day and second on other day, actually, and it has become accessible to all the hospitals. Maybe all hospitals cannot afford to have a high-tech equipments like CT, MRI, PET scan, other things. So definitely it has helped the customer, the patient, the user, and the healthcare facilities, actually. No, when we talk today of, say, hospitals of today, like we talk paperless hospital, or cyberspace hospital, or IT-enabled hospitals, or network hospitals. So I think another issue which is need to be debated, I want any of the experts